Today we're with Ronnie. He's a 53-year-old male who just sprained his lateral ankle. He's still experiencing bruising and inflammation, which means he's still in the inflammatory stage, and his injury is still considered acute. With that said, we don't want to use heat during an acute injury, so we're going to be doing the non-thermal setting on ultrasound today. When we set up the ultrasound, we want to put it at 3 megahertz for the frequency, and for the duty cycle, it's going to be at 20%. These are both because since we are targeting superficial structures like ligaments and tendons, we don't want to be too deep, and this is more of a shallow setting. The intensity should be at 0.5 to 1, and we only want to do this for 5 minutes, again, because we're targeting superficial tissues. When we start today, I want to double check and make sure that he doesn't have any contraindications that are going to affect our ultrasound. When I looked into his chart, he only had coronary artery disease and type 2 diabetes, which both are not contraindications, so he should be good to go. Some of the indications that we want to look for when performing ultrasound include myofascial pain, subacute injuries, soft tissue injuries, and this also just helps with the healing process in general. Some other contraindications that we want to double check that he doesn't have include DVT, impaired circulation, mentality. We want to make sure that he's conscious and able to understand the process of what's going on. We also want to make sure he doesn't have a pacemaker or cancer.
Hi Ronnie, how are you doing today?
Good, how are you?
Good. I heard you have a lateral ankle sprain that you're coming in here for?
Yeah.
How's it feeling? Still hurting?
Yeah.
Still sore and inflamed?
Yeah, it's kind of swollen.
Yeah. So today, I think we're going to try something new. We're going to try our ultrasound. We're not going to put it on the thermal setting because since you're still inflamed, we don't want to increase that at all. I saw in your chart that you do have coronary artery disease and diabetes, but those aren't contraindications of ultrasound, so we should be good. Do you have anything else that's going on?
No? Pretty healthy
No
otherwise.
pacemaker, DVT. You sound pretty good, like mentality. You're talking to me.
Yeah,
All
no.
that. No sensation problems or feeling anything.
No.
All right, good. So when we get started, I'm going to come over here. So now I'm going to set up my ultrasound machine. It's already on sound. I'm now going to put it on 3 millihertz. We're going to put it at 20%. And then we're going to set it at 5 minutes and then put the intensity at between 0.5 and 1. So I'll put it at 0.8 for today. Before we get started, I just want to double check that this is okay with you and then no problems with it or anything. All right, I am going to put this gel on you. It is a little chilly. I'm going to put a towel under your ankle just in case it drips anywhere. So I'll slide this under your ankle. And then we want to put this ultrasound gel between her ankle and on the transducer head because we don't want to put any air bubbles in between. Also, when we start it, we want to make sure that these two are touching each other, the transducer head, with the gel because we don't want to break the crystal at all. Alright, so now I'm going to hit start. And we do want to move in a fast circular or back and forth motion, just because if we just kept it still, she might feel an aching or burning pain. Ronnie, so if you do feel anything, just let me know and I'll start moving in a faster motion, okay? Does this feel okay so far? Alrighty. And we do want to keep it in a small area just because it's more effective when we put it in a small area instead of moving it all over her ankle. Her skin did look good before we did this. She didn't have any open wounds or anything that I should be concerned about, no redness. You still feel okay?
Yeah.
Is it getting warm or anything?
A little bit.
Yeah. Alright, so we do this for 5 minutes and then I would turn it off. So I'm going to hit stop. I'm going to wipe this transducer head off. Put this back. Alright, I'm going to lift your foot up and then wipe this off for you, okay? Her skin still looks pretty good. Nothing's too red. You don't have any pain with it at all? Alrighty. Alrighty, and then I'll ask you when you come back the next time if you thought that helped at all, and then we'll go from there and see if we should use it again, okay?
Perfect. Sounds good.
Alright.
Thank you.